Measures that were announced were guided by science.
The appointment of Dr. Mwangangi as Chief Executive Officer of the Social Health Authority (SHA) has sparked renewed hope and no shortage of speculation as to whether she could be the proverbial exactly what the doctor ordered for Kenya's troubled universal health coverage UHC rollout. Health Cabinet Secretary Eden Duale announced the appointment, describing Dr. Mwangangi a health systems strengthening expert with an exceptional track record of driving policy transformation and financing reforms. Her return to the national health leadership is widely seen as a deliberate and strategic move, emblematic of CS Duale no-nonsense, result-oriented approach to leadership, an approach that has earned him the nickname Bulldozer. Dr. Mwangangi is no stranger to crisis management or public health reform. Her steady and strategic leadership during the COVID-19 pandemic earned her national acclaim as the Chief Administrative Secretary CS for Health during one of the country's most daunting public health emergencies. She became a household name, lauded for her clear and calm communication in a time of panic and uncertainty. While the CAS position was later nullified by the courts, her performance left a lasting impression on the country's health landscape. Before taking the helm at SHA, Dr. Mwangangi served as the Senior Health System Strengthening Director at Amref Health Africa, where she spearheaded continent-wide initiatives in health financing, policy reform, and primary healthcare development. Her experience in mobilizing development assistance and driving progress on UHC makes her uniquely positioned to address the challenges facing a social health authority. SHA, which was established to replace the scandal-plagued National Health Insurance Fund (NHIF), has struggled with a rocky launch. Allegations of opacity, governance shortcomings, and service delivery inefficiencies have kept the authority under intense public and institutional scrutiny. With growing discontent among Kenyans and critical eyes of every move, Dr. Mwangangi steps into a role laden with both expectation and skepticism.
We have been reading, we have been hearing, we have been receiving complaints about SHA, implementation of SHA, with citizens being frustrated, saying that it is not working. Therefore, the Commission decided to do what we call spot checks. So we are moving across several hospitals, the government hospitals, private hospitals, and even Mission Hospital.
The Kenya Medical Practitioners, Pharmacists and Dentists Union (KMPDU) weighed on her appointment with the Secretary General Dr. David Atela, congratulating Dr. Mwangangi, describing her leadership as timely and crucial, acknowledging her leadership in navigating the uncertainties of the COVID-19 pandemic. Both as consumers of the service and as a watchdog, we are confident that you will apply the same depth of expertise and commitment to establish SHA as a people-centered, transparent, and accountable public health cover. Atela, however, did not shy away from outlining the scale of the task ahead. You are stepping into office to find a desk full of complaints from millions of Kenyans and a trail of uninspiring stories about the scheme, alongside multiple petitions from workers' rights groups, including that of KMPDU. End of quote. As of early November 2024, only 42% of private hospitals in Kenya had fully transitioned to the SHA portal. A recent survey conducted by the Rural, Urban and Private Hospitals Association, RUFA, revealed that while 75% of transitioned hospitals can access the new system, many are still facing considerable difficulties. Among the challenges bedeviling SHA are technical glitches. Many healthcare providers have reported issues logging into the SHA system. According to the SHA Healthcare Providers Consortium survey, 64% of providers lacked credentials to access the health system, severely limiting their ability to treat patients. Claims of processing issues. The digital claims processing system has been plagued with failures, forcing providers to revert to manual claims forms. The regression has been a direct response to protests from healthcare providers who found themselves unable to access necessary services. Patient verification problems has also been another challenge. The success rate for patient verification stands at only 50%, with many hospitals struggling with incorrect family member registration details. Is Dr. Mwangangi the proverbial doctor for Kenya ailing system? Well, time will tell. For tonight's edition, I'm Kagunda. Kelvin.